If you've ever had surgery before, you might remember starting to count backwards from 10, 9, 8, 7, and suddenly waking up with the procedure already being over. While it may seem like you were simply asleep, the reality is far more complex and fascinating. We're about to reveal all the secrets of general anesthesia. Before we dive into this video, don't forget to hit that like button and subscribe so you're always the first to find out about our latest anesthesia and science videos. And if you haven't checked it out already, we also have a great podcast that you can listen to on the go. Have you ever wondered what really happens to you when you're put to sleep for surgery? And if you think it's just like falling asleep, think again. In this video, we're breaking down the complicated process of general anesthesia and uncovering what actually occurs in your body. We'll demystify the process and help you understand this crucial aspect of modern medicine that makes many life-saving surgeries possible. Now, general anesthesia is a medically induced state of unconsciousness that renders a patient unresponsive to painful stimuli and unable to be aroused. In essence, it's a drug-induced reversible coma. This state is achievable through the administration of a combination of intravenous medications and inhaled gases, also known as anesthetics. Now, the use of anesthesia has revolutionized modern medicine, but its roots stretch back centuries. So ancient civilizations in Egypt, Asia, and the Middle East describe early anesthetics in their medical texts, using substances like opium poppy, mandrake fruit, and alcohol to dull pain during procedures. However, the birth of modern anesthesia as we know it today occurred relatively recently. The first successful administration of modern general anesthesia took place in 1846, performed by William T.G. Morton, a dentist in the now famous Ether Dome of Massachusetts General Hospital. This groundbreaking event, where Morton used diethyl ether to anesthetize a patient for surgery, marked the beginning of a new era in medicine. In the decades that followed, other agents like nitrous oxide, also known as laughing gas, and sodium thiopental, the truth serum, gained popularity for anesthetic use. Today, we have a much wider array of more refined and safer anesthetic agents at our disposal. Now, the development of anesthesia was a game changer for surgery. Modern surgery really didn't move forward until anesthesia moved forward. Now, you watch some of these old movies, they give you a swig of alcohol, they put on a tourniquet, and they just hack off your leg. And people didn't really do well with that, right? But thanks to modern anesthesia, literally millions of people can have life-saving operations every day with zero discomfort and awareness. General anesthesia is more than just being asleep during surgery. It's a carefully controlled state of unconsciousness that allows patients to undergo procedures that would otherwise be impossibly painful or traumatic. The primary goals of general anesthesia include unconsciousness, so this involves a complete loss of awareness and arousal. Unlike sleep, where you can be awakened by stimuli, under general anesthesia, you remain unconscious even with significant stimulation. Now, the second goal is amnesia, so general anesthesia ensures that you have no memory of the procedure. This is crucial for preventing psychological trauma from the experience of surgery. The third is analgesia, so this refers to the loss of pain sensation. Even though you're unconscious, your body can still respond to pain, so anesthesia blocks those signals as well. Next, we have immobility. So anesthesia causes a loss of motor reflexes and diminishes your motor response to stimuli. This is essential for many surgical procedures. And the last important thing is autonomic nervous system control. Now, anesthesia can affect your vital functions like your blood pressure and your heart rate during surgery, so we want to make sure we carefully pay attention to those things. Now, each of these aspects is controlled by a different area of the brain and the spinal cord. Unconsciousness is primarily mediated by the cortex, thalamus, and brainstem. Amnesia involves the amygdala and the hippocampus. Analgesia is controlled by the spinal thalamic tract of the spinal cord, while immobility is managed by the spinal cord's motor tracts. Now, general anesthesia works by interrupting nerve signals in the brain and body. effectively preventing pain processing and memory formation. But how exactly does it achieve this? Anesthetics affect neurons at various cellular locations, but the primary focus has been on the synapse, which is the junction between nerve cells where the signals are passed. Now, some anesthetics may alter the release of neurotransmitters, the chemicals that carry signals between the neurons, while others may change how these signals are received or processed. The principal targets of these anesthetic actions are neuronal ion channels, proteins in the nerve cell membranes that control the flow of electrically charged particles in and out of the cell. By interfering with these channels, anesthetics can either enhance inhibition or diminish excitation within key areas of the central nervous system. Some anesthetics work on inhibitory channels like those activated by GABA, or gamma-aminobutyric acid. These channels, when activated, make it harder for neurons to fire. Other anesthetic targets include excitatory channels, like those activated by glutamate or acetylcholine, which reduce their ability to stimulate neurons. The net effect of all of these actions is to disrupt the normal patterns of electrical activity in the brain. And normally, different parts of the brain communicate with each other in this kind of chaotic chorus of electrical signals. This connectivity keeps you awake and aware. But when somebody becomes anesthetized, those signals become calmer and actually more organized, suggesting that different parts of the brain aren't talking to each other anymore. It's important to note that anesthetics don't just affect the nervous system. Many also impact the heart, lungs, and other vital organs, which is why carefully monitoring during anesthesia is so crucial. General anesthesia typically progresses through 4 stages, although with modern anesthetic techniques and monitoring, these stages often kind of blend together seamlessly. These stages, also known as Goudel's stages of anesthesia, are 1. Induction. This is the initial stage where the patient transitions from consciousness to unconsciousness. The patient may experience analgesia and amnesia before losing consciousness. Number 2 is excitement or delirium. So in this stage, the patient may appear delirious and may even vocalize, but it's completely amnestic, meaning they won't remember it. There's often an increase in heart rate, blood pressure, and respiratory rate. With modern anesthetic techniques, though, this stage is often very, very brief or just bypassed entirely. Now, the third is surgical anesthesia. Now, this is the target stage for surgery. The patient's breathing starts to slow. They may even stop breathing on their own, also called apnea, which requires ventilatory support. Now, this stage is characterized by muscle relaxation and the absence of response to surgical stimulation. And the fourth is overdose. Now, this stage represents excessive central nervous system depression, including the vital centers in the brainstem. It's potentially life-threatening and is avoided at all costs through careful dosing and monitoring. With modern anesthesia practices, this stage is extremely rare. Now, the concentration of anesthetics in the central nervous system and how that patient responds to verbal or tactile stimulation determines the depth of anesthesia, not the equipment or the medications themselves. Anesthesia providers carefully titrate this concentration to maintain the appropriate depth of anesthesia throughout the entire procedure. Now, there are other types of anesthesia besides general anesthesia, like minimal, moderate, or deep sedation, but we'll talk about those types of anesthesia in another video. Modern anesthesia typically uses a combination of different agents to achieve what we call balanced anesthesia. Now, this approach allows anesthesia providers to take advantage of the beneficial effects of each drug while minimizing the side effects. The main categories of anesthetic agents that we use include intravenous anesthetics or IV anesthetics. These are drugs that are injected directly into the bloodstream. They include Propofol, a common induction agent that causes rapid onset of unconsciousness. Etomidate, similar to the effects of Propofol, but we use this more often in patients with unstable cardiovascular systems. Ketamine provides both anesthesia and pain relief and is particularly useful in certain situations. Next, we have inhalational anesthetics. These are gases or vapors that are breathed in. Examples include sevoflurane, desflurane, isoflurane. And then there are IV sedatives. These include drugs like benzodiazepines like midazolam, which provides amnesia and anxiety relief. We can also give opioids. These are powerful pain medicines like fentanyl that are used to blunt the body's response to painful stimuli during surgery. And we have neuromuscular blocking drugs. These cause temporary paralysis, which is necessary for many types of surgery. They include drugs like rocuronium and succinylcholine. Now, a typical general anesthetic might involve these drugs in this order. So a benzodiazepine like midazolam for amnesia, then an opioid like fentanyl for analgesia, a local anesthetic like lidocaine to decrease coughing and provide additional pain relief, an IV induction agent like Propofol to induce unconsciousness, and a neuromuscular blocking drug for muscle relaxation. And then we top that off with inhaled anesthetic gases to maintain that anesthetic. You may also hear of regional anesthesia and local anesthesia. Now, regional anesthesia is where we use local anesthetics to numb an entire region of your body, like an interscalene block that numbs your shoulder and upper arm. Now, this type of block is useful for providing pain relief for shoulder surgery. Other types of anesthesia are spinals and epidurals. These are called neuraxial anesthesia. We can also just use local anesthetics like lidocaine to numb just a small area of your skin or maybe your gums. The process of general anesthesia can be divided into three main phases. First, the preoperative assessment. So this phase involves a thorough evaluation of the patient's health status. The anesthesia provider will review the patient's medical history, current medications, and any allergies. They may order additional tests if necessary. This assessment helps the anesthesia provider tailor the anesthetic plan to the individual patient, which minimizes the risks and optimizes the safety. Next, we have the intraoperative period, which is during the actual procedure itself. So this phase has several components. First, the induction phase, which is the process of initiating anesthesia. In this phase, the patient is given intravenous medications and/or inhaled anesthetics to induce unconsciousness. The anesthesia provider will say something like, "We've got some oxygen for you to help you breathe. Just oxygen, nothing else. We want you to take some nice deep breaths all the way in and all the way out." This process is called pre-oxygenation, which fills the lungs with 100% oxygen, providing a safety buffer in case there are any difficulties with maintaining the airway. Maintenance phase. So once the patient is unconscious, the anesthesia provider will secure the airway, usually with an endotracheal tube or a laryngeal mask airway. They'll then use a combination of intravenous and inhaled anesthetics to maintain the anesthetic state throughout the procedure. Monitoring. Throughout the surgery, the anesthesia team closely monitors the patient's vital signs, including the heart rate, blood pressure, oxygen saturation, and the depth of anesthesia. They'll make continual adjustments to the anesthetic agents as needed. So waking up from anesthesia is called emergence. So as the surgery concludes, the anesthesia provider will begin to reduce the dose of anesthetic medications, allowing the patient to regain consciousness. Once the patient can control their own breathing and follow simple commands like squeezing my hand, the airway device is removed and oxygen is administered with a face mask or a nasal cannula. After surgery, the patients are closely monitored in a recovery room or the post-anesthesia care unit, also called the PACU. Here, they're watched for any complications and their pain is managed as they fully emerge from anesthesia. General anesthesia is typically administered by a certified registered nurse anesthesiologist, CRNA, or a physician anesthesiologist. In some institutions, these providers work independently, while in other institutions, they work as a team. The choice really depends on factors like geographical location, local needs, and the supply of trained providers. General anesthesia is commonly used for major surgeries lasting several hours, procedures affecting your breathing, operations involving large areas of the body, surgeries on major organs like the heart or the brain, or procedures that have a potential for significant blood loss. The choice of anesthetic technique is determined by various factors, including the type and the length of the procedure, the patient's medical history, and any comorbid conditions like obesity. It's worth noting that there are often more than one way to provide anesthesia for a particular procedure. During the surgery, the anesthesia team uses sophisticated monitoring equipment to track the patient's condition. This includes the heart rhythm, blood pressure monitoring, pulse pulse oximetry to measure blood oxygen levels, capnography to monitor carbon dioxide levels in exhaled breaths, temperature monitoring, neuromuscular transmission monitoring to assess the level of muscle relaxation. We also call this the train of 4 monitor. We also have ways to monitor the depth of anesthesia. So some institutions even have monitors to track the brain's electrical activity, providing extra information on how deeply anesthetized the patient is. And we call these monitors processed EEG monitors, like the BIS monitor or the SedLine monitor. The anesthesia provider can also draw blood samples to analyze various parameters, like blood gases, blood levels, and electrolyte levels. While modern anesthesia is very safe, it is not without risk. This can be divided into common side effects and rare complications. So for common side effects, you may experience sore throat from the breathing tube, nausea and vomiting, confusion or delirium upon waking, shivering, itching, or difficulty urinating. For rare complications, you can have dental injury or damage to your lips, tongue, or airway. You could also have awareness under anesthesia, which is extremely rare with modern monitoring. You could have allergic reactions to anesthetic agents. You could have a condition called malignant hyperthermia, which is a severe reaction to certain anesthetics. You could have post-operative cognitive dysfunction, which is temporary difficulty with thinking and memory, and very, very rarely, complications including stroke, heart attack, or even death can occur. But it's important to note that the risk of these very serious complications are very, very low. At modern hospitals, there's typically only one serious anesthetic accident for every 100,000 operations or so, and most accidents are generally related to the patient's underlying health condition rather than the anesthesia itself. General anesthesia is a remarkable medical achievement that has revolutionized surgery and saved countless lives. It's a complex process that requires extensive knowledge, skill, and constant vigilance from the anesthesia team. While the idea of being put to sleep for surgery can be intimidating, understanding the process can help alleviate some of those fears. Modern anesthesia is safer than ever before thanks to advances in medication, monitoring, technology, and anesthetic techniques. Remember, anesthesia providers are highly trained professionals whose sole focus during surgery is keeping you safe and comfortable. They're there to ensure that you're unconscious, pain-free, and stable throughout your procedure, and to guide you safely back to consciousness when it's over. The next time you or a loved one needs surgery, you can rest assured knowing that behind the scenes, a dedicated team of anesthesia professionals is working hard to make your experience as comfortable and safe as possible. If you enjoyed this introductory video, don't forget to hit that like button and subscribe to our channel. Check out our links below to listen to our podcast, download free study guides, and find us on social media.